I just did a comprehensive treatment guide on all the best new treatments for foot drops so you can't lift your foot. The most important treatment is proper diagnosis, and I go through an entire algorithm for start to finish to diagnose your nerve compressions, the sites, what might be doing it, how effective the treatments are. But one of the number one best treatments, because it helps strengthen your muscles if they're weak, if it's compressed, and it also helps you start walking right away, even if you have lack of signal due to a stroke or a brain injury. The braces are just great for every type of treatment solution if you have a foot drop. Check out those guides on how to diagnose it, the specific causes, and the best treatments for those causes. But here we're going over the best new braces that are out. We're going to include the reviews, the prices, and where to get them. I'm going to count down from my least favorite to my most favorite. And some of these depend on what the cause is, but we're starting from pretty good to the best at number 1. Number 9, the NeoFect adjustable ankle brace. Ankle braces can be very effective. I'm a big fan of regular ankle braces plus orthotics and great shoes. For the vast majority of foot drop, this is the best solution. This provides moderate tension and it allows easier muscle function to work. Again, for foot drop, theoretically, if you put a restrictive brace on, your foot can't drop down, so your toes won't drag. So right away, these lower cost braces with pretty good reviews can be very effective. This brace has 200 plus reviews at about $40. It's available on Amazon. And before we get to all the braces, check this out right here. Unless you have a neurological cause where it's a complete blockage, when the foot collapses, it stretches the nerves on the inside of the ankle, inflames the ankle, stretches the surrounding muscles and ligaments. Wearing a good shoe, such as a rocker bottom shoe, like Orthofeet's great, Hoka's great, the Brooks Ghost Max is great, and putting an orthotic in there. And watch this, foot collapses, strains the nerves, strains the ligaments, the anterior tibialis muscles have to work harder. Whereas here, look at how supportive that is. Collapse, strain, sore, that works good. I'm telling you, try a good shoe and an orthotic for 1 week, 2 weeks, 3 weeks. Most of my patients notice a big difference. It's not a brace, but it works really well. But orthotics, good shoes, and even regular lace-up or compression braces make a huge difference. When I say compression braces, the low-cost sleeves like this for like 10, 20 bucks are very effective. And then also these types of supportive braces that are not specifically foot drop braces can be very effective. If your foot can't lift up at all, that's when the more rigid supportive braces make more sense. Because there's the hard ones that don't flex at all. Now, if you can't get any lift at all, that's when you want to consider those. Number 8, the Swedish AFO foot drop brace. This is designed for walking and use as an ankle foot orthosis for the left and right foot. These are pretty reasonable. They're more rigid if you don't get a signal down. So after a stroke or maybe something like multiple sclerosis, this makes sense. If you don't have any muscle strength, I recommend keeping it in your shoe, then sticking your foot in. They're about $50. It's available on Amazon. Number 7, the Ossur Rebound Foot Up AFO. This slides in, it's easy, it's simple. It improves the gait by lifting the foot up during steps. It has a review of 4.3 out of 5 with 300 plus reviews. It's about $90 to $120. You can get it on Amazon or Ossur's website. Number 6, the Mars Wellness Orthopedic Plantar Fasciitis Night Splint. This one can help stretch the calf muscles, the bottom of the foot muscles. This is a good one. It's got great reviews. This is a nighttime stretch splint. You could walk around with it at home. Number 5, the Furlove Soft AFO. It's soft, it's breathable. It has an upper brace that can be worn barefoot or with a shoe. It has great reviews at about a 4.5 out of 5 with 320 reviews. The price is about $40. You can get it on Amazon. This is one that helps keep your ankle more stable. It's if you have a weak ankle, not necessarily zero lift up strength. Number 4, Swedo Step Up Smart AFO. This features a strong hinge that assists with normal gait by lifting the foot. These can be really good. This is a very good specific ankle foot orthoses. has great reviews at 4.6 out of 5. This is a legitimate brace I want you to consider at this point. If you have true drop foot, like after a stroke, 400 plus reviews, the price ranges in the $100 to $150 range. Check it out on Amazon as well. Number 3, the Step Smart Drop Foot Brace. This is an innovative design with a Jacob joint technology for shock absorption and natural foot position. Great reviews at about a 4.7 out of 5, 350 plus reviews, but it's more expensive, $150 to $200. You could get it on Amazon or Step Smart's official website. Number 2, the Saebo Step Foot Drop Brace. This one is pretty good because you don't put it into your shoe. It actually attaches to your ankle and your shoe, so it's an external brace. Now, there's a lot of knockoffs. There's cheaper Chinese knockoffs for like $40, $50 on Amazon. The reviews are pretty bad on this. I've had patients that showed me the Saebo Step Foot Drop Brace. The results are pretty good. The reviews are 4.8 out of 5. It's only available on their website. And the reason they don't really sell on Amazon is because the return rates on these braces are high. The people that it works for, they work amazing. It's different than the rigid brace that goes into your shoe, and it's more expensive. It attaches to your laces on the front of a running shoe and helps lift it on the outside. It's about $150 to $200. This can work really well. Saebo Step also sells like packages, like stimulators that can try and work out the muscle at the same time. There's something else called the ankle roll guard. It's not necessarily a drop foot brace, but with drop foot, a lot of my patients sprain their ankle. So this thing, you can essentially put it on over the shoe wearing the ankle brace, and this can prevent your foot from rolling out. So you could see this gentleman, he puts almost all his weight on the outside of the foot and it does not turn out. So it's essentially a $20, $30 product that goes on over your shoe. So if your problem is not the drop foot, but just like a weak rotated in foot, that's a slightly different problem. But this might be a solid option, but the braces that I recommend here may be a good combination with this, or you might not need this at all. Something worth considering if your foot rolls in. But that brings me to number 1. The functional electrical stimulation device. This is an actual prescription device that you get with your doctor at a medical supply store. The patients that have this love it. Now, not everybody needs this. If you have any strength at all lifting up your foot, don't spend money getting this. This is only for people who have strokes or no signal down at all. So I had a patient, for example, who crushed his leg and the nerve function does not work at all. This works perfect for him. I have another patient who had a stroke. This works perfect for him. If you're someone with back pain, stiff hamstrings and calf muscles, this is not the answer for you. It's not gonna work well for you. You wanna get just a regular lace-up ankle brace, good orthotics and good shoes in this case. But in this case, if you have no lift at all, no sensation on the top of your foot, this works great. I even saw used ones available on eBay for lower prices. You can probably get it shipped anywhere in the world, but otherwise you need a prescription for these. The reviews are great. They're very practical because you actually go into the store and get fitted. They make sure it's working. The price is like $1,000+. You do need a prescription. The Journal of Neuroengineering and Rehabilitation shows that the results are great. I highly recommend talking with your podiatrist, with your physical medicine rehab doctor regarding this, and you can get a prescription. Here is the big secret. For the vast majority of the people, most of these nerve injuries are due to nerve compression, tight joints, tight muscles, and weakness. If you can evaluate your foot and they can turn up, they're just weak and stiff, good shoes, good orthotics, muscle strengthening, physical therapy, stretching, you can get nearly 100% relief. But if you had a stroke, if you crushed your leg and killed the nerve, if you were hospitalized for 2 weeks and your one foot does not work compared to the other, that's where the functional electric device or the hard rigid braces make sense. Braces, they can be good. Most of the time I see people buy the wrong ones. You don't have to go expensive. If you're just weak and stiff, don't get the expensive stimulator. That's only if there's no nerve signal getting down to your foot. I'm a big believer increasing your hamstring flexibility, your calf flexibility. And again, this depends on what's actually wrong with you. If you do have strength lifting it, working on your tibialis anterior and stretching your calf muscle can work really well. I'm a big fan of the knees over toes guy, Ben Patrick, but essentially what you want to do is get up against the wall, put your butt up against the wall and lift your feet. That's working your tibialis anterior. Do that a couple times a week until you can't do it anymore. Keep strengthening your drop foot lifting muscles. Keep stretching your calf muscles. So calf stretching devices make a big difference. Strengthen your tibialis anterior, strengthen your hamstrings, and do split squats. I'm a big believer in split squats. Again, the knees over toes guide does them. I'm a big fan of these. Makes a huge improvement in strengthening those muscles. This is very practical, very easy. You can start doing this at home. 2 days a week, do 2 sets per muscle until you can't do them anymore. For the split squats, support yourself on your counter. You don't have to do it with crazy weights, just do it with your body weight. His books basically talk about strengthening and stretching at the exact same time. But what it really comes down to is 4 simple exercises. He does the split squat. So 1 foot in front, 1 foot in the back. This is a 75-year-old person doing it, but basically 1 foot in the front, 1 in the back. I usually put my hands on counters or a chair to get more help. As you lean forward, as you lean back, you can feel it stretch the front of one leg and strengthen the other leg. So you can see in the most advanced steps, it's kind of him doing that right there. That's an advanced split squat. Next, how do you strengthen your hamstrings? Basically stand, lean forward against a chair, bent over, and have your knees bent and then extend them. That works your hamstrings. Just do that until you can't do it anymore. So split squats, 2 or 3 sets, and then the hamstring extensions, 2 or 3 sets. That's it. It's that easy for your thighs and your hamstrings. I'm telling you, if you do that for a month, 2 months, you'll notice your muscles will adapt. Then after 2, 3, 4 months, your fascia, your flexibility will adapt. I'm telling you, when I started doing these exercises, I immediately started walking faster and stretching better. And then for your ankle, there's 2 exercises. There's the tibialis anterior workout. So basically, you just put your butt up against the wall and you lift your feet. And that's it. That works your tibialis anterior. The more forward your feet get away from the wall, the more you can lift your feet. It's that easy. It is such a straightforward exercise. It works so well, but it works your anterior group muscles, your tibialis anterior. And then calf stretchers. I have a link, a stretch block right here. It costs $19 to get a stretch block, or you can just put your foot up against the wall, or you could lean forward and bend your knee forward. I like the stretch block. It's pretty easy. I have one in my workout area. I do my deadlifts, everything on it. Those 4 exercises right there, you don't even need the equipment. Split squats, hamstring extensions, stretch your ankle, and work your tibialis anterior. You're going to get pretty equal. I'm telling you, they have trained thousands and thousands of people. People get faster, more flexible. That's the real underlying cause. I'm a big fan of these exercises. Obviously, there's a lot more you could be doing, but that's 4 simple, effective exercises that make you flexible and strong. Check out my guide on the exact causes and the 10 best treatments that I use for my patients. Check that out below.